Hi, I'm Aaron Cook. I'm from Physical Therapy and Balance Center. We're here with our next Ask an Expert section. We are here with Janice Bacak. She is the owner of Resilience Pelvic Physical Therapy. We're here to talk all things pelvic floor physical therapy, something that a lot of people in the community may not be aware that exists. And I want to talk about how it's one of the fastest growing fields in physical therapy. And it's just such an honor to have you on. I appreciate your time. But
Thanks for having me.
thanks for being here. So, I'm really interested. Every PT has the same 5 to 10 origin stories, but I'm curious about why you got into physical therapy, and then what drew you into pelvic floor physical therapy.
I guess probably the same as most PTs. I just wanted to be in the healthcare field and to help people in some way. So I ended up in physical therapy 25 years ago. I think I started PT school. So I never thought I would do pelvic health in PT school. With a lot of people have a 1 hour lecture, and I thought, no way, I'm not going to do that.
I think I had a weekend course, and I remember thinking, wow, this is something that I think is very beneficial and is very relevant to not just these sorts of specific issues, but also just low back pain and some other issues that you may not associate with the pelvic floor.
That's great that you had a weekend course through school. So, and some schools don't, it's still a 1 hour lecture. So I, like a lot of pelvic PTs, ended up having children and had my own issues in pelvic health. And I thought, there's something I can do about this. So I went on for training and just fell in love with this field of physical therapy.
And I'm so glad you brought that up. We were talking before we started recording. The reason why I sought out a pelvic floor therapist is, I'm a physical therapist. I'm married. I have 2 small children, and as a therapist, we're used to treating our partner's aches and pains, and they did something stupid that they shouldn't have been doing, and we try and fix them and try and do what we can. And then when my wife had kids, I could not fix her low back pain. And just as a therapist and just as like a husband and a father, I was just so devastated. I was like, I can tell that you're in pain. I can see that you're struggling. You're having these issues, and I do not know what to do, and I do not know where to turn. And I got in touch with a good pelvic floor therapist back when we lived in Las Vegas. He gave me some tips and some exercises, but I'm just so passionate about bringing this pelvic floor concept to the world. I want the general public to be more aware of it. So I appreciate the work that you're doing, and I really hope you're giving a lot of people a lot of help. So for the general listener, what sort of issues does a pelvic floor therapist treat?
So we treat a lot of issues either with difficulty emptying bowel or bladder. So that could be urine retention or constipation. We also deal with issues related to keeping it in. So incontinence or leaking of anything like urine, or even having leaking at the bowel as well. The other big portion of patients we see are patients with persistent pain. So it could be pain in the pelvis, persistent low back pain, or persistent hip pain where we don't know why it's staying there. So there may be a pelvic floor component. Also, pain with intercourse is another big patient population that I see as well. And then there's pre and post any kind of pelvic surgery. It could be any gynecological surgery or a prostate surgery as well. Or it could be just general low back pain strengthening, or postpartum feeling like I need to get back to some sort of strengthening, maybe feeling like their abdominal muscles or their core just aren't activating well. So I see patients with those issues too. It really is a full gamut. It could be just being able to pick up your child without pain or feeling strong, to maybe running a marathon and not leaking. So it can go through the whole spectrum.
No, wonderful. And it's such to me as a therapist, it makes sense how these things are related. In PT school, the first thing they teach you in your spine class is your red flags and any changes to bowel or bladder. And if you have back pain and something weird with peeing or pooping, okay, we need to address this. There might be a little bit more. So to a therapist, that sounds very, very, I can connect the dots, but I could see how a lot of people wouldn't necessarily make those connections and think, oh, my back pain, maybe I should go see a pelvic floor therapist to help with the pain.
Right.
You also hinted during that you see not just female patients, you see a lot of male patients, a lot of, prostate surgeries, prostate issues. I'm curious, if there's, for the guys out there listening, what sort of issues would the men have that could benefit from you?
Yeah, besides having prostate removed from cancer and some of the issues with incontinence and erectile dysfunction after that, I do see people that have, and I say people because all genders. So I see people that have issues with pelvic pain. I would say out of the people assigned male at birth that I see, it is pelvic pain in a great deal of the patients, and they tend to be younger. So they might present with urinary issues, and they might be going and getting antibiotics from physicians and really not knowing where the pain is from. And of course, over time, that pain becomes persistent and becomes a chronic issue that a lot of people don't know what to do. So pelvic PT can be very helpful for that diagnosis too.
Fantastic. I was thinking on the drive over here, I'm always thinking of a good icebreaker question. What's something we can really kind of get into the nitty gritty, and I don't know what I'm going to ask her. How am I going to start this? And I was thinking, she has to have a lot of difficult conversations with a lot of people every day about peeing and pooping and sexual function. What are your tips and tricks just to help your patients feel calm and feel, that they can talk these things out? We're in Northeast Ohio. Not a lot of people are as open as a pelvic floor therapist on, I had a little bit of, urinary incontinence when I went to pick up my daughter, and I don't feel good about that. I'm curious if you have a way that you help your clients feel more at ease.
Well, one of the first things I do is I do send an intake form prior. So I have a lot of questions open-ended. So I want to know why someone's coming and what their expectations are. So I'm meeting that. And it just helps me know how to steer my questions. And I also ask some of the questions on the intake. So people already have an idea that I might be asking this. They can put as much as they want to share. But then during my intake, I usually have someone across from me, just like you are, and I do offer an out. So I say, you don't have to answer any question you don't want to answer, and most people are saying, okay, this might be too much information, and there's never too much information, but I'm usually sometimes the first person they've discussed some of these issues with, and because they think they're the only one. And so sometimes on the intake form, and they see the questions and they think, okay, then maybe I'm not the only person dealing with these things, because a lot of people don't want to talk about it.
And you bring up such a good point about just that connection of, I'm not the only person. This is something that other people have dealt with and have gotten better from. And just that is such a component where you've built your practice. The first thing she said to me when I came, do you want a cup of tea? It's very inviting. There's nice little rugs in here, and it's very, it's very calming, very soothing environment. So I can see how you've definitely done. You even got a physio ball there. I'm sure you're using that. Your energy radiates. This is someone who knows how to get me better and is going to make me feel comfortable. So I think you're doing a great job of that.
Oh, thank you.
I'm always curious about, if you could do a public service announcement, if you could do, clear up any misconceptions about pelvic floor therapy, if there's anything that you really want to express to the world or to get out there for the general public to know.
Well, a couple of things. I think one piece is that coming to a pelvic PT does not necessarily mean that you would have to have an internal pelvic floor exam. So sometimes people think, okay, I'm not going to do that. That's not what I want to do, and that's totally fine. So there are a lot of things that we can help with that doesn't include an internal exam. So that's number one. But I think the biggest misconception on patients coming in, when I ask them, what is your goal for physical therapy, for pelvic therapy, a lot of people write, I need to strengthen my pelvic floor, or my pelvic floor is weak and I need to get stronger. And I would have to say, over 90% of my patients are on the other side of the spectrum, where we're working on people with too much pelvic floor tension, and whether it be from their exercise or childbirth or whatever issue that created a little too much tension at the pelvic floor, or the thought of, I need to strengthen, and people holding their pelvic floor in tension a lot. Chronic sitting, and also just chronic or just anxiety. People who have these very go lives and don't have the time to relax, maybe have that pelvic floor tension. So I'm working on helping people to decrease that tension. And that tension can manifest as like constipation. It also could be incontinence, because when a muscle is tight, it doesn't work as well to help you stay continent. So I would say the biggest thing is not to go and do a lot of pelvic floor strengthening exercises like a Kegel, because that may end up creating more of a problem. It might increase back pain, it may increase constipation, and even just one visit in pelvic physical therapy can help guide someone to see if they need to strengthen the pelvic floor or work on activation, or if they need to work on lengthening and relaxing.
See, I'm just sitting over here just thinking how many patients I said, oh yeah, try some Kegels, and then go find a pelvic floor therapist. I'm as soon as you said that, I was like, oh no, I'm a fraud.
No, and it's and we're trying to get the information out there. So you are helping as much as you know, and we're still trying to get the information. Even physicians are giving that information on a daily basis, saying go and just strengthen. Here's a piece of paper and do some strengthening exercises, and it's actually the opposite of what people need.
So then I'm curious, a lot of people might be thinking, physical therapy, pelvic floor, strengthening, relaxing. What do these exercises look like? How, what does a therapy session consist of? Am I going to be lifting weights? Or, people can get some humorous images. I'm sure you have patients probably come to you with some misconceptions there. But I'm curious what sort of, techniques you use, if there's any, treatment modalities that you use. What have you found is like a good, successful strategy?
Well, I tend to work a lot with breathing. So I'm really working on connecting your breath to the pelvic floor and feeling how the pelvic floor is really connected to almost any activity. So any exercise could be a pelvic floor exercise. So if someone likes to do weightlifting, I may be working on incorporating that into squats or deadlifts or different activities. If someone likes yoga, I received my yoga certification this year. I incorporate their exercise program into yoga. And it really is what they like to do. So anything can be a pelvic floor exercise. I just try to incorporate more concepts into what they're already doing. And it could be running. It could be they are working in Pilates, and I'm just incorporating into that. But other hands-on things that I do, I work on a lot of myofascial work. That could be at the abdomen. I do quite a bit of that.
Visceral release and things along those lines.
Also visceral mobilization, dry needling.
Do you do pelvic floor dry needling? I've heard that this is a thing. I did not know that you did that.
Yes, so it is special coursework. So I've taken a 4-day course on pelvic floor dry needling. It's not something I use the first time I see someone, or it might not be something I use at all, but it is one option.
So for the lay person out there, dry needling is the simplest way to describe it is acupuncture, though it is not acupuncture.
Right.
But it is using different please, I'm not a dry needling therapist by any means, but you should explain this, but you can do it better than I can, so I don't know why I'm gonna try.
Well, dry needling is just something that some physical therapists and other practitioners use when they've been trained using an acupuncture needle or a different kind of myofascial dry needle into a muscle. So it could be to help affect the nerve. It could help maybe break the cycle of tension in so many words. So they could see
where those spasm, that tension that you're talking about. I could see where that dry needling could help get some relaxation there.
Yes, and again, since it's at a very delicate, sensitive area, it's not something I bring out first thing. And most of the time when I'm using it, it's patients finding out about it and seeking me out for that reason. So
it's growing in popularity. I believe, please correct me if I'm wrong, but as I understand it, in Europe and I believe Australia, it's commonplace postpartum is pretty much everyone's referred pelvic floor therapy, as I understand it. And that is not the norm in the U.S. by any means. Most people, they go through labor delivery, and this isn't even on their radar until they start having issues. I remember when my wife had our kids, I saw a meme that like always stuck with me, and it was ACL reconstruction, 2 to 4 weeks of this, isometric at this, prolonged weight bearing, and then it was having a baby, and it was like pre do nothing, then post do everything.
Yes.
And it stuck with me because a lot of people they don't get that return to work, return to activity guidelines and a lot of people struggle with it.
They do, and I mean, you're really going into here's another human that you're now taking care of, and a lot of people have a hard time getting back into exercise. Maybe they get back into exercise and just don't feel like things feel right in their body. So that would be a time to see pelvic physical therapy. And it doesn't mean that you would need it for a long period of time, but just enough to help guide you more into movement patterns. So a lot of the hands-on work is just something that helps you get back to having a better movement pattern. And I definitely had a movement-based background to help people get back into exercise in a way that is supportive to their bodies and maybe not in a way that's putting too much pressure, say, at the pelvic floor.
Wonderful, wonderful. Mm-hmm. I'm curious, for people that are out there that might be thinking, okay, you've talked about a lot of things that I struggle with. One, what's your contact information? How do people get in touch with you? And two, I'm curious if you could walk people through a little bit more about what that first day really, really looks like. And I'll have links to all your contact in the video, so we'll have, your phone number and everything, but just since we're on it.
Okay, so my first evaluation, it is, I do a longer period of time. So it's about 90 minutes for my, maybe longer. Sometimes I do allow a little wiggle room in between. Sometimes it is hard when you have a newborn.
I just want to repeat that and emphasize that
Yeah.
because I don't know if you've been to a doctor lately, but 90 minutes one-on-one, that is almost unheard of in medicine these days. So I applaud you for just taking that extra time and energy to really sit down and get to the roots of some of these problems. But I cut you off.
Yeah, that's fine. And I mean, of course, I set it up that way because that's what feels right to me. And usually there's, for some patients, it's set up of childcare and all these different things. And so to come for a half an hour, 45-minute initial eval is difficult. So I do set it up for a 90-minute. And but I have my intake paperwork. People are doing that before, and that way I can read it before you come in. And then when we sit down to talk, I've already have an idea of why you're coming here, and we're not having to go over your whole history because I already have it and I've already read about it. And then I usually do an orthopedic exam. So I look at posture, I look at your spine, I look at the hips, your core, breathing, if you have any scars on your abdomen. I screen for diastasis or diastasis, which is a separation of the abdominal muscles on any person that comes in, any gender. And I then tie in what I've learned in more the orthopedic eval to the pelvic floor exam. So I always say we could do a pelvic floor internal exam, and then I have many models over here. I show on the model what that would look like. And that way you're well informed. And then I say at any point, at any time, if you decide, you know what, I just decided not to do the pelvic exam, totally fine. And it could be at the pelvic exam where people are saying that. So I usually put the model right next to people and then explain what the exam is again during the exam. And most of the time people are covered because I can't see the muscles. So people have a sheet over them, and it's very modest, and really try to make sure people feel secure and in this environment. So we're looking for muscle contractions and how well the muscles contract, how well the muscles let go, and we're also looking to see if there's any points of tenderness, and then trying to decide why might that be there based on the orthopedic exam.
I'm curious, going back a little bit, we kind of touched on this with the dry needling about, relaxing those muscles and how, this is overly tight is more of an issue and they need to relax. I'm curious if you have any preferred biofeedback mechanisms that you use to actually cue that in. Some people, there's the old school blood pressure cuff versus, like an EMG activation. I'm kind of curious what you found work, or if it's more just just learning that motor control and just teaching people that muscle memory on how to do it. I'm curious what works for you.
Yeah, and I guess it is mainly based on what works for the patient. So one of the easiest ways to do biofeedback is with hands, to monitor muscles. And I also teach the patient, or teach you how to monitor yourself. So you can do self biofeedback. So you would know outside of our clinic what the things that you can do and help to monitor if your muscles are contracting or letting go. But I also do EMG biofeedback, which is, there are a couple of ways to do it. It is little electrode pads to put, if, say we put them on the shoulder or the abdomen or the pelvic floor area, it would just monitor how much muscle activity is happening. And if we're working on strengthening, you can see on a monitor if you are contracting those muscles or if you're working on trying to decrease the tension. So that can be helpful for some people. There's also probes that can go internally as an option as well. So we have those available, but I have to say I use that kind of biofeedback very rarely, but it's available because it is gold standard as far as treatment for some things related to constipation.
Okay. I'm curious about, we've talked about the biofeedback, we've talked about, some manual therapy techniques. I'm curious if there's any, and just the way you're doing, kinetic training, whatever words we want to use it. I'm curious if there's any other, like ancillary things you're adding to your treatment, things like diet, things like, just general mental well-being. As therapists, I always took the therapy part of physical therapist somewhat seriously, and I try and have those extra conversations with patients, even though we're not psychologists, but I'm sure I could imagine you have a lot of patients that have had trauma, that there's some issues there that, they don't necessarily need you to be their therapist, but they do need somebody to talk to. And I'm just kind of curious what other aspects, fall under the scope of PT practice that people might not think of.
So that's a good question. I do, in my intake, have questions about, one is, are you dealing with any life stressors right now?
Mm-hmm.
And with COVID, a lot of people, right? COVID, enough said, but just maybe their people are, have moved, or they had a birth loss, or something they're dealing with, and we can sometimes relate that to the onset of some of their symptoms. I asked about sleep, so that's a big thing. So I can work with someone on body tension and pelvic floor pain, but if they're not sleeping, there is a limitation to how much we can help as therapists when someone has a big stress load and lack of sleep. Nutrition is a big piece. Asking about bloating, I ask a ton of questions about the bowel, and because that can be a stressor on the pelvic floor in general, and then seeing how I can help people go to the provider that they need to. So I do refer out to GI specialists or integrative medicine practitioners. And also another subset are psychologists that specialize in some pelvic pain conditions. Is another. There are other practitioners that I tend to refer to.
CBT for certain patients would be a benefit.
Yes, and working as a team with that practitioner too. I know that some of the trauma issues I am not qualified to work with, and I help people to find someone that is qualified in that way, so we can work together to really make a long-term solution to some of their issues.
Do you have any favorite success stories, or is there a stereotypical success story? I own a balance clinic, so to me it's people that come in on a walker and they throw their walker away. I'm curious what the pelvic floor equivalent is for that.
Oh, there's so many.
So anyone donated you a box of adult diapers and said, "I don't have any leaking anymore. Take these."
Well, that's part of it. It could be, some of the men I see post prostatectomy being able to then go for a walk and not have any leaking. It's a big quality of life issue. Since I deal with so many quality of life issues, it's maybe running, being able to run in a race without leaking. I just had a previous patient shout out on Facebook to me after she ran a half marathon and saying,
that's awesome.
I could do this because of the treatment I received. So it was a nice, it was humbling to see that. And then there's also the pain piece. So with the clients that I see, in people that have had pain with intercourse, they might have always had it, and maybe are not able to consummate their marriage. And so sometimes people that get to that point and are pain-free, those are other success stories. I know it's not a normal PT association, but pelvic PTs, that's usually like I helped to help them help themselves.
Build that relationship.
Yeah, to feel like to get where they want to in life. And if that's the goal, then it's really exciting. So
that's fantastic. That's a great place to end on. I had one more question though, but I feel like I might re-edit that around.
Yeah.
I'm really just kind of curious about, what drove you to start your own practice?
I've been a PT for 22 years, and I've been in pelvic health for about 11. And really it was COVID, one of those COVID silver linings that
That's when I started my clinic was, okay, COVID's ruining everything.
So it helped, to reevaluate what do I want to do. And I did want to create a practice at this point of my career in a way that I felt would serve my patients the best and myself. And so that is taking longer treatment times, allowing for not being rushed.
You found the system hamstrung your ability to help patients.
Right. Yeah. And to be able to connect in the way that I wanted to. So if people have questions outside of their therapy visit, they can contact me, they can text me or email, send a video, whatever, and we can contact each other in between. So I have my business set up for that, but also as someone in the community as a resource. So I commonly have people call. We might talk about pelvic health, and it turns out that my model of therapy business doesn't work for them, and I will help them get to that next person and make sure they can find a therapist that maybe is in their area or that works out for their insurance situation. I just want to help bring more education about pelvic health to Northeast Ohio.
Fantastic. So we'll put the website up in the description. Anything about the business model? You kind of hinted at the end that you are a cash pay only model.
Yeah, so it is out of network for all insurance, which means that people pay out of pocket to see me, but if you have out of network insurance benefits, I can provide you with a receipt that you can then submit to the insurance company. So in some cases it's a better option if you have a high deductible and you might be paying a little bit more for PT than you would anticipate because you need to meet a deductible. There's no surprises in the fee. And then most
people are surprisingly receptive to that. We do a little out of network, and it's just it's going to cost this much. I'm going to make you feel better. Come on in. Let's chat for a few minutes. See if this is right for you. I think I can get you better. It's going to cost this much, and then you do it, and it works, and people are very happy about that. So it sounds like you're like me, where it's just you want that honest transparency about this is what it's going to cost. There's no surprise bills at the end. There's no guesswork with the insurance. It's just this is what it's going to be.
Right, and if people, I commonly will talk on the phone or even do a video call prior to making an appointment, if that's what helps people see if this is right. And honestly, if I don't feel like I'm the right first practitioner for you to see, I will help refer you to someone who would be the right person to see. So the conversation is not to sway you to make an appointment.
Fantastic. All right, Janice, thank you so much for your time. Anything else you want to make known to the world?
Yeah, I just, knowing that there is help for a lot of pelvic health conditions, and you're not alone, definitely. And as far as finding, out about pelvic therapy, you can visit my website, and I have scheduling either online through there, or you can just contact me directly.
Fantastic.
All right.
Thank you so much.
All right,
Until
thank
next
you.
time.